Every day, doctors, nurses, laboratory professionals, housekeeping staff, ambulance personnel, and hospital support teams dedicate themselves to saving lives. But while caring for patients, they face an invisible threat that cannot always be seen, smelled, or felt. That threat is biological hazards. Welcome to Hazard of the Week, where we identify one workplace hazard in every episode and learn how to recognize it, control it, and protect ourselves and others. Today's focus is on biological hazards in the healthcare industry. What is a biological hazard? A biological hazard, often called a biohazard, is any biological agent that can cause disease or harm to humans. These hazards include bacteria, viruses, fungi, parasites, blood, and other potentially infectious materials. Unlike many workplace hazards, biological hazards are often invisible. You cannot identify them by sight alone. That's why awareness and preventive measures are essential. Where are biological hazards found? Biological hazards exist throughout healthcare facilities. Common exposure areas include emergency departments, intensive care units, operating theaters, clinical laboratories, isolation wards, blood banks, dialysis units, ambulances, medical waste storage areas. Even housekeeping staff and waste handlers can face significant biological risks during routine duties. Common sources of exposure: healthcare workers may be exposed through needle stick injuries, contact with blood or body fluids, airborne infectious particles, contaminated medical equipment, improper handling of laboratory specimens, medical waste, contaminated surfaces. A single lapse in infection prevention can expose multiple people. Let's look at a real-world scenario. A nurse finishes drawing blood from a patient. Instead of immediately disposing of the used needle into a sharps container, she places it temporarily on a nearby tray. While cleaning the area, another healthcare worker accidentally suffers a needle stick injury. The investigation reveals that the incident occurred because safe sharps disposal procedures were not followed. This was entirely preventable. Possible consequences: exposure to biological hazards can result in serious illnesses, including infections caused by viruses, bacteria, fungi, or parasites. It may also lead to occupational illnesses, long-term medical treatment, psychological stress, lost workdays, increased healthcare costs, risk of transmitting infections to coworkers, patients, or family members. Protecting healthcare workers also helps protect patients. Warning signs you should never ignore. Always remain alert for warning signs such as damaged PPE, overflowing sharps containers, improper waste segregation, blood spills, leaking specimen containers, poor hand hygiene practices, patients requiring transmission-based precautions. Recognizing these hazards early prevents exposure. Controlling biological hazards. The most effective way to control biological hazards is by following the hierarchy of controls. Whenever possible, eliminate unnecessary exposure. Use engineering controls such as safety-engineered needles, biological safety cabinets, and proper ventilation systems. Implement administrative controls, including infection prevention protocols, vaccination programs, standard operating procedures, training, and reporting systems. Finally, use appropriate personal protective equipment. No single control works alone. Effective protection requires multiple layers. Essential PPE. Healthcare workers should always select PPE appropriate for the task. Depending on the level of risk, this may include disposable gloves, medical masks, respirators when required, safety goggles, face shields, isolation gowns, shoe covers. Always inspect PPE before use and remove it safely to avoid contamination. Remember, improper removal of PPE can be just as dangerous as not wearing it. What should you do after an exposure? If an exposure occurs, immediately stop work. Wash the affected area with soap and water. Flush eyes or mucous membranes if exposed. Report the incident immediately. Seek medical evaluation without delay. Follow your organization's exposure management procedures. Prompt reporting allows timely medical assessment and appropriate follow-up. Never hide or ignore an exposure incident. 5 safety tips. Remember these 5 essential safety practices. 1. Always perform hand hygiene. 2. Dispose of sharps immediately after use. 3. Never recap used needles unless specifically required by approved procedures. 4. Wear appropriate PPE. 5. Report every exposure or near miss without delay. Every safe habit protects not only you, but also your patients. Weekly recap. Let's review today's key learning. Biological hazards cannot always be seen, but they can often be prevented. Recognize exposure risks. Follow infection prevention practices. Use engineering controls. Wear appropriate PPE. Report incidents promptly. Together, these actions create safer hospitals and healthier communities. Healthcare begins with caring for others. But before we can protect patients, we must also protect ourselves. Knowledge, awareness, and professional safety skills save lives every single day. Thank you for watching Hazard of the Week by the Safety Skill Development Foundation. If you found this episode valuable, like, share, and subscribe. Join us next week as we explore another workplace hazard and learn practical ways to build a safer world. Because at SSDF, safety is the first skill.